Hello, I'm Mirza, and later today I'm going to be attending a discussion on summary care records and pharmacy at the House of Parliament hosted by the Royal Pharmaceutical Society. So this is a subject that many pharmacists, myself included, have been campaigning for quite some time, and I think it's a culmination of a lot of hard work from a lot of people. So firstly, what are summary care records? So basically it's a summary of key clinical information for a patient. So it'll have information on current and past medication. It should detail any known allergies and any known medical interactions that a patient may be susceptible to. So what about the future? For me, giving access to community pharmacists, well, it's really the next logical step. I think we're going to see read-only access to start off with, but I'd like to see it move into read and write access pretty soon. We're seeing social care and healthcare becoming a lot more integrated, and we're seeing the lines between primary care and secondary care becoming a lot more blurred. And I think community pharmacy is going to be central to ensuring that patients get to the right care provider at the right time. Whether we like it or not, I think we are going to see a move towards hub and spoke pharmacies, with the high street becoming a lot more focused on service delivery, leaving the bulk of medication supply to a centralised facility. I think with the change, and indeed the pace of change, it's really important that pharmacists have got the right information at their fingertips to deliver the best care for their patients. So how would patients benefit? Well, we've been doing a lot of work with GP practices, and I've got to say having access to proper medication records has allowed us to improve patient safety, improve compliance and adherence, and massively reduce costs, without having to constantly wait for a GP who's already very busy to answer a simple query. And I think some of that's replicable in a community pharmacy setting as well. So we waste so much time trying to get simple information from a GP surgery to a pharmacy and vice versa, with the patient losing out, along the way. By having the patient's permission to access their SCR, I think we can really improve patient care and the whole patient experience as well. Are there any risks? Well, Spider-Man's uncle would say, with great access comes great responsibility. So, firstly, there's an issue of liability, for example. Would a pharmacist be liable if something happened because he didn't check the SCR? But I think once we start using them, we're going to develop the right systems, the right processes, the right checks, the right balances to make sure that the right information is checked when it's appropriate, just like we use patient medication records. Information governance. So how safe is electronic information? Well, to access an SCR, not only do you need a patient's consent, you also need an N3 connection, which is a secure connection to the NHS. You also need an NHS smart card. And every single time you access an SCR, there's a record, there's a full, complete audit trail of who accessed, when it was accessed. And when we have read and write access, we'll also have a full audit trail of that. So how accurate is the information? Again, working in GP surgeries, we've been doing a lot of work to ensure records are kept up to date and are kept accurate. And I think as more and more SCRs are used, the onus is going to fall on GP surgeries indeed to make sure that the record is kept up to date. So to summarise, with all that being said, I think the benefits far outweigh any risks. It's really important for us as a profession, as pharmacists, to get behind this change, to embrace it, and start making summary care records work for our profession, and most importantly for our patients. Thank you very much.